I will call this meeting to order. Representative Schlegel, would you lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, good morning, everyone. My name is David Rowe. I have the privilege of representing the 85th Legislative District, which includes all of Snyder and parts of Union, Juniata, and Mifflin counties. I would like to ask all of the members to introduce themselves. We'll start all the way at this far end with Representative Zimmerman and work our way straight on down.
Good morning. I'm Dave Zimmerman, represent Northeast Lancaster County and Southern Berks.
Representative Flick, 83rd District.
I'm John Schlegel. I represent the 101st Legislative District in the heart of Lebanon County.
Good morning, Dane Watrow, parts of Luzerne and Schuylkill counties.
Representative Jim Struzzi, Indiana County.
Representative Eric Nelson, Westmoreland County.
Representative Barb Gleim, portions of Cumberland County.
Representative Joe Diorsi, Eastern York County.
We also will have members jumping on and off online. We also might have a couple of members coming and going. It is a session Monday, so it's a busy day here in the Capitol. I want to specifically and intentionally thank all of the members who have joined us this morning. I know on Monday morning, getting into the Capitol early can be very tough, but I am very grateful for all of your dedication and commitment to be here. What we're here today is to talk about something very important. We're here to ensure that Pennsylvania's safety net is fair and reserved for those who truly need it. In Pennsylvania, unfortunately, over 1 million able-bodied adults are enrolled in Medicaid. 1 million able-bodied adults. We're talking about people who can and should be out working, contributing to our economy. While those 1 million able-bodied adults are sitting at home, we have 14,000 Pennsylvanians, meanwhile, that are sitting on a waiting list. It's not just inefficient, it's unjust. Our most vulnerable are being ignored. And we owe it to our taxpayers and those who are the most vulnerable among us to root out that fraud, waste, and abuse in our benefit systems. Because we believe firmly that social programs must be a hand up, not a hand out. And when the system is stretched too thin, it fails everyone, those who rely on it and those who provide for it, including those who it was designed to help. We are not here to talk about denying help to those who legitimately need it. In fact, we are here to make sure that those resources are being prioritized, protected, and responsibly managed so those individuals who need these resources most have access to them when they need them. Pennsylvanians deserve benefits that reflect a good government, and I'm looking forward to discussing today how we can hold our government accountable. We have two testifiers today. I want to thank you both very much for being here, both from the Foundation for Government Accountability, Ms. Caitlin Finley, who is a policy fellow, and Mr. Trevor Carlson, who is the senior research fellow. We're going to give you both 3 to 5 minutes to kick things off with testimony, and then we want to make sure we leave time for questions and answers from the members. So Ms. Finley, you're up first.
Good morning, everyone. Mr. Chairman and committee members, thanks for having us. My name is Caitlin Finley. As you said, I'm an associate fellow with the Foundation for Government Accountability. We're a nonprofit think tank dedicated to helping every person reach their full potential and making sure resources are available to those who need them most. So we know Pennsylvania cares about helping its most vulnerable, as you mentioned, Mr. Chairman, by providing a strong and reliable safety net. But today we want to talk about how we can better protect the integrity of Medicaid and food stamps specifically. So let's take a look at how your welfare programs have evolved since 2000. The table here shows how much it's grown. Back then, food stamps, or SNAP as it's called, enrollment was around 770,000. Today, it's nearly 2 million. That's an increase of 1.2 million people. Spending has jumped from 655 million to over 4 billion. And for Medicaid, it's the same story as you see on the table. Much of this enrollment increase is due to Medicaid expansion under Obamacare, which opened up eligibility to more able-bodied adults. As you'd expect, because of this, spending has increased more than 300%, hitting 44 billion. You may think some of this is due to more people coming into the state, but the numbers don't bear that out. During the same time period of welfare enrollment skyrocketing, Pennsylvania's population only increased around 800,000, or 7%. That means the SNAP program alone has added more people than the state's population growth. So this is not sustainable. So to get Pennsylvania's welfare system back on track, today we wanted to focus on 3 goals: protect the resources for the truly needy, stop fraud at the source, and empower independence to help folks move from welfare to work. Medicaid was initially designed for truly needy folks, those with long-term healthcare needs. Over time, it's shifted, covering more populations that I mentioned earlier. In 2015, before Medicaid expansion had really taken off, able-bodied adults accounted for 18% of the Medicaid rolls. Today, that population has grown, accounting for 28% of enrollees. And unfortunately, many of them are stuck on the sidelines not working. Our data shows that 578,000 able-bodied adults reported no income in 2022. That means about 40% aren't working. While we expanded coverage to able-bodied adults, there are still thousands of people with intellectual or developmental disabilities waiting for more Medicaid services. There's been progress to provide more funding to try and eliminate the waiting list, as I'm sure all of you are aware. But at the end of the day, it's not just a funding problem. We need to ensure there's enough staff and enough workers to help take care of those folks themselves. But unfortunately, data shows that there are declines in the workforce despite 250,000 open jobs in the state. So as you can see on the graph here, as welfare programs typically expand, we can see that work participation has actually dropped in the Keystone State. You can see an X in the graph here on the screen. We call this the X factor. This graph shows as welfare enrollment in food stamps and Medicaid has increased in Pennsylvania. Labor force participation rate has dropped. We see this across the country and we see it here. Loading up the program with able-bodied adults in this way makes these programs even harder to manage. You're driving up the workload for state employees who are processing eligibility determinations. And all of this can make errors more likely.
And so let's talk about those errors. The federal government regularly audits and reports improper payments for both Medicaid and food stamps. As you can see on the slide, both the payment error rate measure, or a PERM, as it's called for Medicaid, and food stamp error rates are high. You're looking at about a 15 to 20 cents out of every dollar as wasted spending. And this is a low estimate. That 14% for Medicaid is from 2019, which unfortunately is our most recently reliable audit, and we could talk more about why the subsequent audits are not reliable in the question and answers. But the main takeaway here is that there's a considerable amount of fraudulent spending that doesn't go where it's intended. You can't spend the same dollar twice. Improper spending crowds out your ability to care for the intended recipients and other spending priorities. It's certainly a driver for why Medicaid is taking up more and more of your state spending. If you look at a pie chart of state spending, it'll resemble something of a Pac-Man gobbling up other spending categories. No doubt you're aware of this when you look at the budget. You might be thinking, okay, that's Medicaid. We state has a share of that. But what about food stamps? Doesn't the federal government cover that? And that's correct. Historically, food stamp benefits have been entirely financed, federally financed, with Pennsylvania's involvement limited to just the administrative costs. But Congress is reconsidering that dynamic. The reconciliation bill that recently passed the House of Representatives calls for a minimum 5% share for all states. You can think of that as kind of becoming more in parity with Medicaid, where it's a state-federal partnership. Importantly, the proposed 5% share is a minimum. The rate will ratchet up to 15, 20, or 25% depending on your state's improper payment rate. So this number is going to really start to matter to you. Last year, total spending on food stamp benefits in Pennsylvania was $4.27 billion. At the very least, you're going to be on the hook for 5% share of that. That means budgeting roughly $250 million, starting with federal fiscal year 2028. But with an improper payment rate above 10%, which you have currently, the number is actually going to be much higher for you. You're looking at about $1 billion. That would be the state share. And again, that's just an estimate based on current spending. The good news is you have control over those projected price tags. First, getting an improper payment rate down below 6% is going to change the matching fund formula, get you down to that 5%. The other lever at your disposal is constraining the overall size of the program. 5% of a modest number will be more manageable. So if you can lower overall spending by helping people transition off the food stamps program, there'll be less of a budget impact. I mention this because it's eventually a budget consideration you'll need to grapple with, but the real improper payment rates are substantial. Both Medicaid and food stamps use the term improper payment. This makes it sound benign, but another word for improper payments is fraud. We've we've covered that 15 to 20 cents of every dollar spent on welfare in Pennsylvania is fraudulent, and that's money that won't be going to help the truly needy. But what exactly is fraud, and how do you stop it? Here's a recent example. This is the kind of thing we're most likely to think about when we hear welfare fraud. This news release from the Department of Justice is just from about a month ago. Philadelphia man used stolen or manufactured identities to obtain Medicaid benefits and EBT cards, which he reportedly sold to a local supermarket. How does that happen? Well, as we'll see in a moment, it's a design flaw. It's fraud by design. Neither your Medicaid nor food stamp programs guard the front door. Your welfare department accepts unverified self-attested information when it enrolls people in these programs. So let's focus in on some of these Medicaid policies.
As you can see from the red boxes on the table, some states let people just say they qualify for Medicaid without actually checking and verifying. When you look at Pennsylvania's Rowe, it shows that Pennsylvania doesn't double check if someone actually lives in the state before giving them benefits. We let them on first, ask questions later. They also don't verify how many people are in a household. And both of these things are very important for making sure people really do qualify.
And there's another avenue outside of the typical Medicaid enrollment process that's worth covering. Likewise, like we just discussed, the central problem is a failure to protect the front door. And that problem is called the hospital presumptive eligibility. HPE is an Obamacare creation. There was a precursor, but that was limited to pregnant women and children. It was a noble idea, ensure immediate access to care using a temporary Medicaid eligibility determination. But opening that up beyond the narrower group has led to significant abuse and misuse. It's become another avenue for fraud. It's the same problem we were just discussing with overall Medicaid. On the screen are some numbers obtained through a Right to Know Act request. Last year, Pennsylvania hospitals made more than 2,000 presumptive eligibility determinations, but only about 2/3 of these folks were ultimately checked for eligibility in the end. Of those who did submit an application for full Medicaid, only about 60% were found eligible. Taken together, we can only confirm that less than 50% of those enrollees actually were eligible for Medicaid. Could be higher, but we only know that 49.87 of them were. Again, these decisions are being made without verifying things like residency, income, citizenship, etc. The good news is you have options to address this, and we can talk about that more at the end. But let's pivot over to food stamps for more examples of fraud by design. So far, we've talked about stopping fraud at the front door, and that's key, but there's more to worry about than just having the programs infiltrated. There's also the matter of fraud after someone has been enrolled, legitimately or otherwise. Taxpayers understand the value of providing a safety net for the needy. We're a generous country, and we take care of our own. But it's also widely held that welfare should be reserved for those in need. For able-bodied adults, especially those without young children in the home, welfare should be temporary. It's not supposed to be a way of life. If we don't provide people with a pathway to self-sufficiency, they get trapped in government dependency. And right now, the system is oriented toward dependency. Again, it's fraud by design. The able-bodied adult without dependence or ABOD time limit waiver for food stamps is a perfect illustration. So there's a federal requirement that able-bodied adults on food stamps work as a condition of enrollment, and that's pretty common sense. Unfortunately, Pennsylvania has specifically asked and received permission to cancel that requirement for able-bodied adults without kids in the home. As a consequence, less than half of ABODs on food stamps are working at all. In fact, the work requirement is only in effect in 5 of Pennsylvania's 67 counties. Importantly, your Department of Human Services had to get creative to get the waiver to be that far-reaching. They used an allowance in current regulations to waive the requirement in contiguous counties with an unemployment rate above 20% of the national average for a recent 24-month period. But there are several problems here. One, the time period used was arbitrary. It's not the most recent unemployment rate. The waivers were requested in June of last year, yet go back as far as February 2021, meaning they disregarded the most recent year and a half so it went from 2021 to January 2023, meaning they disregarded the most recent year and a half of time when the unemployment rate was actually relatively low here in Pennsylvania. Another issue is this contiguous county business. They combined counties with low unemployment rates with areas that had higher unemployment rates. As long as the combined exceeded 20% of the national average, USDA would waive the entire group. And that's what these colors on the map indicate. That light blue area is one combination of counties, the navy blue is another, and green is another. Those two with yellow stripes indicate that the counties themselves were not waived, but just jurisdictions within them. The counties had very low unemployment rates, but they went and looked at particular municipalities to find where they could waive just those areas. This convoluted mess is, again, fraud by design. Your own DHS is actively working to waive the eligibility requirement. Instead of encouraging people along the off-ramp, they're making it easier for people to be stuck in a welfare pit. Now, thankfully, Congress is cracking down on this particular gimmick. The legislation that passed the House eliminates the ability to gerrymander counties like your DHS did for this map. So you may be thinking, all right, Congress is already on this, not our problem. But I caution you against that. As a general rule, you don't want to wait on Washington. You are the Pennsylvania legislature. It's your prerogative whether a state agency asks the federal government to waive policy in your state. DHS files this request with USDA every year. But how many of you were shown this map before today? Even if Congress fixes this loophole, you should require state agencies to seek legislative approval before they can submit a waiver like this. And this advice also applies to hospital presumptive eligibility, but again, we can talk about that more later. One last example of fraud by design before we run through our recommendations and get to your questions. The next is the BBCE loophole. Now, BBCE stands for Broad-Based Categorical Eligibility. It's another innocuous sounding name, but it's really just another example of fraud by design. The way it works is the state welfare agency deems someone categorically eligible for food stamps by extension of them receiving a TANF benefit. But here's the kicker. The TANF benefit can merely be the receipt of a brochure about program benefits printed by the department using TANF funds. Receipt of the benefit makes the household categorically eligible for food stamps. Households enrolled through this avenue are then exempt from the food stamp asset test. That means people get food stamps without having to part with non-essential assets like recreational vehicles or a second home. And you can even have thousands of dollars in the bank while still receiving food stamps.
So back to Medicaid, a few reforms that we wanted to share with you. As we talked about before, let's stop things at the door. It's way easier to catch things that folks that shouldn't be on the program, rather than going back and doing audits, trying to do restitution. So first, as we talked about, we need to stop allowing self-attestation when people apply. We should trust but verify. So every dollar we spend on those that aren't eligible can't go to someone who is. And then also, we need more robust data cross-checks. We see this in a lot of states. Even if agencies are doing it, it's very important that we codify that. So no matter what administration, what executive is in charge of those agencies, they still have the direction to ensure that those data cross-checks are happening. And then also, as Trevor mentioned, there are ways to reform hospital presumptive eligibility rules. If a hospital repeatedly enrolls ineligible individuals, they may lose the privilege of using this shortcut. It's a common sense way to hold these hospitals and providers accountable. And then also, on the next portion, we should give people a reason to get back involved in their communities if they're receiving benefits. So whether that's by training, volunteering at their local school, or finding another job. This is the best way to help connect them with others, get back on their feet, and start earning income again. Indiana's recent passage of its comprehensive Medicaid reform package shows that states aren't waiting on Washington to improve program integrity for Medicaid and food stamps. We can act now to protect the truly needy, reduce fraud, and help folks break free from dependency.
Yeah, and then again, two of the recommendations we've already talked about, no longer waiving the ABOD work requirement, ending the BBCE loophole. I didn't speak much about mandatory ENT. We can definitely talk about that in Q&A if you'd like. But at this time, we'd be glad to kick it over to you all for questions and further discussion.
Thank you very much. That was a ton of excellent information. Trying to keep up here has been tough. We do have several members with questions. For the members' information, we do have a hard stop at 10. So we want to try to get through as many questions as possible. You're both welcome to answer all the questions or pitch it back and forth, whatever makes it easier for you guys. But we're going to start things off with Representative Nelson.
Thank you, Mr. Chair. I really appreciate the timeliness of this hearing. There's a lot of effort and coordination that goes into a hearing. And to be able to have this hearing the session week following this issue coming up on the floor. Last session week, my microphone was cut off 3 times raising this issue of selective county work requirement waivers. And it was ironic, the leader of the Democratic Party, his county, the wealthiest, second wealthiest county in the state, they have work requirements. So their businesses are getting those employees, their senior homes are getting those part-time workers. Each time it was mentioned, they cut off the mic. So the other key part of your testimony was in the fraud that we're not checking if people are dually applying across state lines. So can you share on the intersection of both of those comments? About 160,000 able-bodied adults without kids are not working, in those remaining counties. So the consequence to wealthy counties having their able-bodied workforce and working collar counties not having that workforce, at the same time the incentive to double dip, because we sometimes get lost in the silo of Pennsylvania. So we don't see the scale of both double dipping and the absence of getting these workers plugged back in to our businesses.
Yeah, it's a great question, a great problem to be addressing. In 2023, there would have been a full year of data available for unemployment rate for which the waiver was used. Again, I said they only went into January of 2023. They completely ignored that entire calendar year. 3.82% was the average statewide unemployment rate, or excuse me, in one of the areas that was waived, the average unemployment rate would have been 3.82%. They said that it was the unemployment rate. The reason for the waiver was that the unemployment rate was 20% above the national average, which was 5.2%. So, I mean, it's a rather odd accounting gimmick that they're using to broadly waive things. And to your point about when you have the incentive to work and you're not waiving the requirement for those who are on the program, you're making it easier for businesses to hire. I think you've got 265,000 open jobs in the Commonwealth. That's a lot. And I would say in those cases, many employers aren't going to list the 10 jobs that they actually need. They're going to triage their hiring, right? So they're going to be looking for, what do I need the most? And then once you bring that person on, say you have a business where you're dispatching technicians and you need to hire another technician. Well, once you hire that new technician, you get them trained up, they're going to help perpetuate more business for you. Eventually, you're going to need to hire additional dispatchers. And so by cutting off the source of the source of labor and people working this early, you're delaying that eventual growth. So you're exactly right that it's detrimental to the small businesses and getting the communities growing. Yeah, go ahead.
Yeah, go ahead, Caitlin, if you had.
Oh, you mentioned Medicaid and folks enrolling in other states. I think in our notes we had nearly 20,000 Pennsylvanians were enrolled in Medicaid, were concurrently enrolled in another state. So that's just something to keep in mind on the Medicaid front. That shouldn't be happening. And especially if you're in a managed care situation, you're paying thousands and thousands of dollars every month, every member per month. So all those funds are not going to eliminate the waiting list, for instance, because money you use over here can't be used over there. So that was just an interesting find from an audit a few years back.
So how does this, because you touched on, it's the same department that's waiving the work requirements, is also have placed mandate on our senior facilities for worker ratios. So we had a appropriation hearing 2 weeks ago where 50% of the county home, it's at 50% capacity because they can't get workers because there's this waiver. But then you mentioned the fraud and how the big beautiful bill could hold Pennsylvania more accountable for the fraud with our co-payment. So how do they dig in to reduce some of that fraud, or what happens if this passes? Would that bill be due 2 years from now? Is that something that needs to be factored into this pending budget?
Yeah, so the increase in shares for the food stamp program, they may or may not do anything on Medicaid. I think there's, my crystal ball is still on back order. I'm not sure exactly what Congress is going to end up doing. I know there is a version of bill that passed the House. It's now with the Senate, and we'll see what happens with the sausage making in Washington, D.C. But on the food stamp side of things, again, not to get too far ahead of things, but those changes seem to be agreed upon by a larger share of members in Congress. And so you can almost take that to the bank. Again, there may be some changes, but it seems that in fiscal year 2028, the state is going to be on the hook for a 5% share at a minimum. And then, again, the rest of the share will be dependent on the improper payment rate. And while we're on it, I just want to also say the 17%, I think was the number on the slide, that's probably low. Right now, when they do those audits, they discount any error that's under $60, just because the thought was, well, it's small potatoes, like why bother? But in that same bill, they are going to no longer make that disregard. So it's not that you've got a 17% payment error rate for food stamps. It's 17% minimum error rate currently. So it's actually it's more of an uphill battle. But that's essentially what the share is on that side. And then there may be additional changes on the Medicaid side. I just hazard to get too much into those weeds when there's a lot more uncertainty over there. It seems to be an area that's still debate.
Thank you, Mr. Chair.
Representative Flake.
Thank you, Chairman. Thank you both for your testimony today. I know we keep using the phrase able-bodied, and I really think, Chairman, that should be changed to able-minded, because with today's technology, we have people online. There's not a person here today that couldn't be laying in bed, seriously, without standing up doing the exact same thing. So many jobs available that you literally don't have to leave your house. But you had mentioned about more robust data cross-checks and frequent redetermination. I'm curious how other states are doing. My background is data analytics, and I had a software company in the human services sector that was in 61 of the 67 counties. And I'll give you a couple examples. We did MA eligibility checks through the Promise system every single night at midnight. We took whatever, 1 million records, sent them, and we would find out the next day for each county who gained MA, who lost MA, who went to an MCO, who lost the MCO. And I believe the state only does it maybe 4 times a year. We were doing it 365. And that's the difference between a private company and the state. I hate to say it now that I'm a state employee. But one example was the HCSIS and the Pelican downloads. Then we push it to the Promise system. I had a county call that said, hey, we forgot to use your software, a large county in the southeast. What can you do for us? Well, if you wait 180 days to submit these claims, they're denied. And same thing in the private industry. So I said, well, you've waited 180 days. There's nothing I can do. Let me contact Human Services and see. I was able to recoup a little of the money, but the attitude is also bothersome. It was $3 million. They said, that's okay. We have to spend it by June 30th. Don't worry about it. And I hope the members know that this attitude and this, we have to spend it by June 30th or we lose it. I don't know what other states do, but I just wanted to throw that at you and listen to your comments. Again, thank you both for being here.
Thank you for those comments, Representative. Looking into this issue more about data cross-checks, I was surprised how many times it's not stated in statute. I do know Texas, for instance, it does have in their statutes specific directions for at least quarterly checks on a lot of those items that we spoke about before, residency checks, mandating use this database and check over here. I think with artificial intelligence becoming like increasingly available and probably going to be cheaper over time, I think we'll be able to do even more cross checks more easily. So that is something to keep in mind, but it is important to actually do them because people do fall through the cracks. And the evidence of that is audits that we see after the fact. I believe there was one audit that was a few years ago that found about 2,500 adults on receiving benefits, but they were deceased, but they were still receiving benefits. So there needs to be checks with your Office of Vital Statistics is what it's called in a lot of states. They will check whether at least monthly if those persons are still deceased, because sometimes providers themselves, if they are unscrupulous, will continue to make payments like, yes, this person came in and give services, but actually that person's deceased. So it's not just someone forgetting the family, if someone who's deceased forgetting to take them off. Sometimes it can be malicious actors as well. So it's very important to check, are they still with us? Do they live here? Those things are very important at the front door and also for renewals as well.
Okay, thank you. Thank you, Chairman.
I want to mention we have been joined online both by Representative Marcel and Representative Kephart. We also have been joined from a representative from the Legislative Liaison for the Department of Human Services. Thank you for being here. Representative Barb Glide.
Hello. I would like to go back to the page where you're waiving the food stamp work requirement and the colors that you're using. So what is the blue and gray striped mean? Is that the same as the yellow and gray?
So yes, on that slide, if you're talking about Cumberland.
Yeah.
Yeah, so Cumberland is only partially waived as well. And the reason is they needed, so I did not actually review the mechanics behind the waiver. I'm not sure that USDA makes those public. They may, but in order to include Franklin, they had to waive at least some of Cumberland. So Cumberland is only partially waived. I'm not sure what portions, but the waiver specifies that it's just a portion of Cumberland.
Right,
that
their
is waived.
unemployment there is low.
Exactly.
So that you did mention that
Yes.
that's why they couple them. So my real question is, how can we enhance that collaboration or decouple that? I mean, so that that's not happening. Like Cumberland has low unemployment, but I guess Franklin has high unemployment. I don't understand how they're able to couple those counties together. Is there a specific like law in place that allows them to do that?
So current regulations with the U.S. Department of Agriculture, which has jurisdiction over the food stamp program through FNS, that's the 20% above the national average, I guess, pathway that I was talking about. Again, Congress is going to presumably dispense with that. My understanding of the legislation, of the reconciliation bill, is that you will only be able to waive for areas that have unemployment rate above 10%, which is more of a realistic, that indicates high unemployment. So that is in the works. But you can also require, as a legislature, that before your Department of Human Services submits any waiver, whether it be here or with the, they have to file a state plan amendment for hospital presumptive eligibility. Any waiver that an agency is going to submit to the federal government, you can require approval of that prior to them submitting it. And that's just great oversight. It's a way of knowing what exactly they're doing. They get communications with federal agencies every day. They get guidance, things that you may not be privy to. And it's worthwhile, it'd be prudent to make sure that they are sharing that information with you. So legislatively, it looks like Congress is going to be addressing that. Even still, like I said, it's worth, again, regardless of what Congress does, getting oversight of those waivers. And I would say the other thing that makes it less likely for them, again, independent of what happens in Congress, is it's at the discretion of the Secretary of Agriculture to grant these waivers. Brooke Rollins has already issued guidance, a memorandum to state welfare agencies that there is in the previously passed Farm Bill, there is a statement of the intentions of the program, and it is the intention of food stamps is to help people get back to self-sufficiency, and the current U.S. Department of Agriculture is going to honor that. Past administrations have not.
And then one last question, Mr. Chairman. Can you give me, I mean, you mentioned Texas, but could you give me like maybe the top 3 states that you would say have best practices when it comes to this process?
Sure, Texas one that came to mind. I'd have to go back, but happy to give that to you when we circle back for other states as well. It was few and far between when I started and researching. I thought I would find it in statute and it would be an easy job, but it has been harder to find. Sometimes it's an administrative code that this is the procedure. We will do this check. We will do this check at this time. But even then, sometimes it's not followed. So putting it in statute is the best prescription for that, but I'll make a note of that and be happy to give you that information.
Thank you.
The one that comes to mind right now, just it's a recency bias, Senate Bill 2 in Indiana, they were already doing most of those cross-checks at the front door, and SB 2, in addition to several other very positive, strong reforms, it codified some of that. And so Indiana is certainly a state that is headed in the right direction on this question.
Thank you.
Representative Razzle.
Thank you, and thank you for your testimony. Are we seeing illegal immigrants access these benefits, and in particular on the Medicaid side, or hospitals access these benefits to recover expenses from said individuals?
Are you talking about Medicaid, food stamps, both?
Medicaid primarily.
Okay, Medicaid primarily. On the, I have not looked at what numbers are available for Pennsylvania specifically, but the broader answer is yes, that there are avenues for permitting people who are not in this country legally to be receiving benefits, even if just for a short period of time. Congress or the Department of Human Services, Health and Human Services, HHS, has in code something called a reasonable opportunity period, where if they're not able to verify someone's citizenship, they are put on Medicaid for 90 days, during which they are supposed to be proving their identity. And in several states, actually Texas is one of them, someone has been on a reasonable opportunity period for over a decade. I don't understand why it would take someone more than 10 years to be able to prove their citizenship, but in Texas there's at least one example, and that was from a public records request we filed down there.
Okay.
Yeah.
Thank you, and I'll be introducing legislation to get more specific on those numbers. My second question is, what is the #1 means in which folks are committing this fraud in either program? Is it the cross state lines? Is it, what is the #1 way that they commit this fraud?
I'm not sure that I have a great answer for you on what the #1 is. I think the better way of thinking about it is that these are all avenues and they all deserve attention to be stopped. Again, a lot of people may not consider the waiving of work requirements for some people, not a lot of people. Some people may consider that waiving the work requirement for people who, in statute, should be limited on their food stamp recipient or on receiving food stamps, waiving the work requirement for them. Some may not consider that fraud, but it is, because it's violating a tacit agreement between the taxpayers who are only providing the resources because they know that there are people who actually need and are in a situation where they are relying on those benefits. And to waive those for able-bodied adults violates that agreement. So I'd say it's very broad, and there are many avenues through which fraud is being committed.
Thank you.
I could add to that. When audits are done, whether by the federal government or state audits, what we typically find is eligibility errors are the most frequent type of errors that there are. Some of that fraudulent and some not. But going off of that, that's why the front door is so important, because it does take resources to go and find the big schemes that we think about, food stamp benefit frauds. The example that was shared on the screen earlier, that man who, I think it was $1 million stole from taxpayers. Those stories exist, but they take a lot of effort and resources to catch. But it's much better ROI to just have a strong front door, so you don't have to go back and do that. But it's both. It's frauds. It's the stories that we shared, but it's also bad policy, the fraud by design that we spoke about. All that wrapped together, whether it's 60-40, 30-70, I'm not sure. It's kind of hard to know, but it's really important to just catch it at the front end.
And if I may just add, one thing we haven't talked about, but this got some media attention over the last couple of years, is EBT skimming. So you take your EBT card, you go to the grocery store, you swipe it, and someone has put on that reader, or on that scanner, a reader that then duplicates the information, and then the person who orchestrated that can then recreate your card, go drain all the benefits, and you've got someone who is supposed to be receiving benefits who goes and has a balance of zero. Congress made what I think is a imprudent attempt at addressing that by using federal dollars to reimburse those benefits. Maybe a viable short-term solution, certainly not something that's going to stop the problem from perpetuating. The reforms we've been talking about, doing those cross-checks, seeing where dollars are being spent, if they're regularly being spent across state lines, that's a pretty good indicator that that person no longer lives in the state. And they could be, these transactions can be happening very far away. The card may be issued here in Pennsylvania, but if you have repeated uses down in, say, Florida or Texas, that's not like they just went over to Ohio, just because they were, visiting family or something like that. That's, if it's occurring repeatedly, it's a pretty good indicator that you can do further investigation to find out if that person lives in the state any longer or not. Because if they don't live in the state any longer, they're actually not eligible for your food stamp program. They should be enrolled in the other state's program. So that's just another avenue that, or another way that fraud occurs, but can be addressed by some of the things we've been talking about.
Okay. Thank you, and thank you, Mr. Chairman.
Chairman Struzzi.
Well, good morning. Thank you both for being here. I have to get to a 9:30 meeting, so I'll keep this brief, but I think the numbers that you shared at the beginning of your presentation are quite staggering. Looking at how much basic reliance on welfare programs, Medicaid, food stamps have increased over the past 5 years, it should be alarming to everyone. And I appreciate that you suggest legislative oversight when it comes to the waiver process, but I think you know the challenge that we face, because we do ask on many occasions for them to not submit those waivers, yet they still submit those waivers. And again, the challenge is we're in a divided government here in Pennsylvania. So as much as we would like to curtail some of this, we have our challenges before us. So are there any examples from other states that you could give where it's a similar situation, yet they've been able to pull these numbers back in? And we hope that at the federal level, maybe some of these waivers start to be denied, and that helps us here at the state level. But it's a real challenge for us, and we look at how much these numbers have increased. We look at how much Pennsylvania's budget has dramatically increased over the past 7 years. I think the taxpayers in this Commonwealth need to really realize what's happening and see where all these dollars are going. But any advice you could give us on how to address this situation, knowing that we're in the minority here, and as much as we want to stop this fraud and this waste, it's very difficult. So.
Sure, that's a great point with the political realities that we face. Other states in the exact position, I'm not sure. I know in Arizona, the legislature's had to override some vetoes there with the governor. Some other slightly divided in other ways, other states. But at the same time, I think really focusing on the issue at hand, fraud, waste, and abuse. I know Governor Shapiro has spoken about EBT fraud, for instance, the skimming that Trevor just mentioned. Saw a press release maybe a few months ago on that, and has put some money towards eliminating the waiting list for those with intellectual and developmental disabilities. I think in any of those areas where there is some seemingly bipartisan support, I don't know who would be against curtailing fraud, waste, and abuse in these programs so that we can make sure the resources are going to those populations. However that can be used in all the backdoor negotiations, I think is the best way forward. But Trevor, do you have anything to add?
Yeah, I would just say one thing is to approach it with a radical incrementalism in mind. If it's 10% of a loaf, 20% of a loaf, you don't have to try and get all of these things passed at once. Although, if you could, that'd be great. But I'd also say, again, sort of Caitlin was just saying, the oversight of waivers is not particular to any particular governor, right? Like that, if you were to have that would be for whether they happen to be a Republican governor, independent, Democrat, it doesn't really matter. The point is the legislature, in a nonpartisan fashion, deserves to have that level of oversight, regardless of who's in the governor's office. And so that's the way to think about it, is that this is not a partisan issue. This is the legislature picking up the mantle and conducting the oversight that's due for executive branch agencies. So maybe framing it in that way will help with those conversations. But we'd also be glad to take a look back at any of the other states that may have been in a similar situation and what approaches they might have taken, and get back to you with any answers.
Thank you. I appreciate that. We would welcome any assistance that you could provide. Thank you. Thank you, Mr. Chairman.
Thank you, Chairman Struzzi. Representative Schlegel.
Thank you, Mr. Chairman, and thank you for this very timely topic. I found it to be very interesting and enlightening. Appreciate our testifiers being here today for your clear and concise testimony. I really have a statement. You're certainly welcome to comment should you be moved to do so, but I think some of your comments probably have already been made in reference to Representative Flick's question to you. But relative to Medicare payments, it's come to my attention this year that at least one provider in the 101st District experienced process and payment issues that took quite some time to resolve. And in this instance, in my district, this particular facility had over $1 million of Medicaid payments withheld due to both a computer and a currently undisclosed error. And while these matters have been resolved, it is frustrating for the provider who was struggling to meet payroll and maintain their business. So I not only support benefit integrity, but also efficiency and expediency in the payment process. And I call on DHS to examine their procedures to not only prevent fraud, but also provide for the resolution of payment errors in a timely and transparent manner. Thank you.
Thank you, Representative. Representative Dorsey.
Thanks, Mr. Chairman. I just have, it's kind of like a housekeeping question, for lack of a better term. Page 1, there's a chart with some figures. The bottom line speaks of Pennsylvania population. So when I first saw this, I was very curious because Pennsylvania's one of the leaders and have been for the past 5 or 10 years in domestic net migration. So I'm trying to make sense of this. We've lost, conservative number, 250,000 people in the last 15 years. And I went back and I looked at the window of time between 2000 and 2005, and sure enough, we did gain some population, but there's still a discrepancy of about 700,000 people. And the only explanation, I was talking to Rep. Rosel, because this is a good follow-up of his question, the only explanation I have is that there's 700,000 unaccounted for illegal immigrants in Pennsylvania. Is my thought process right here? Because we have indeed lost population in Pennsylvania, but these figures don't speak the same story.
Thank you for the question. Yeah, I was using census data that's just publicly available to get those figures. I'm really not sure if we can contribute it to that, but Trevor's is a number guy, so you have anything to add? We sometimes look at figures like that, but yeah.
Yeah, and that's not census data is not quite our area of expertise. Our purpose in showing that was to indicate that while the population has increased, at least according to census data, the numbers of enrollment on both Medicaid and food stamps, you can't put all of that on population growth. In fact, it's a stark difference. So our purpose for that chart was to indicate that you have even a greater share of your state's population who are enrolling in those programs.
Representative Watro.
Chairman, thank you very much for having this hearing today. I knew there was a problem, but not to this extent. Page 1 of your slideshow, it's alarming. Chairman Struzzi used those words. It is very alarming. We're not talking about putting our 80-year-old grandmother to work. We're talking about, as you said, able bodies and being on these programs very temporary. That's what we should be doing. The checks and balances, I don't understand why that's not being done. It's a no-brainer. The question was asked earlier as well, which I'm very interested in. What states are doing it the right way? Programs out there that we could echo and maybe follow as an example. If you could get that back to us, I'd greatly appreciate it. But how could we better align welfare benefits with job training? Do you have any suggestions or comments on that?
Yeah, so you actually have an employment and training program in the state. All states do, actually. And you spend 28.3-ish million a year on that. But you don't actually require anyone to participate in that program. So of the about 4,000 people that DHS anticipated would voluntarily participate, you're looking at about, sorry, I'm checking my notes here just to make sure I'm getting this right, an operating cost of about $6,700 per participant. You're already spending the money. If you were to require mandatory ENT employment and training, you'd get a lot more bang for the buck. One of the ways I like to think about it is with employment and training, so the Phillies were just in Pittsburgh, so I'll use a baseball analogy. I don't know what the fans' situation here is, but I do know that Pittsburgh swept that series. I'm not a Pittsburgh or Phillies fan myself, but big baseball fan. So a lot of people will go to a baseball game and they'll use ride sharing, Uber, Lyft, or that sort of thing. The chief economist from Lyft was asked once about this surge pricing. We increase the rates that we pay our drivers when we have when there's high demand, and the idea is to incentivize people. They get the ping on their phone. Hey, we need more drivers. Come out. Like you'll get a higher rate. He said that's actually turns out not all that effective. Marginally, it does get some people out there, but it's not a great way of doing it. The best way is we know there's a game in Pittsburgh, and it's the Phillies, Pittsburgh. It's going to probably be a well-attended game. Before that game, we're going to inform all of our drivers in our network, here's what your increased rate is going to be. And so those drivers, they're not getting off the couch or canceling the plans or whatever. They're already out. They're already planning on being out on the road. Same principle applies with ENT. By requiring employment and training for people who are going to be enrolled in food stamps, you're already greasing the skids and making it so that when you have open jobs, open opportunities, they're already well connected to them. So waiting and just waiting for those opportunities, waiting for jobs to become available and so forth, you're losing time. And so anyway, maybe not all that helpful of an analogy, but it's the one thing that comes to mind for me. So I'd say employment and training is one of the levers for you to be able to pull.
Trevor, I got to say, I'm a little disappointed hearing
Oh, gosh.
you're not a Phillies fan. But
I love the ballpark. I've been many, many times. I'm a Giants fan.
well, thank you very much for your testimony, Chairman. Thank you for having this policy hearing today. This really shed some great light on what needs to be fixed. We talk about school property taxes all the time, and I mean, this source of revenue could probably fix that issue whole-handedly. Thank you.
Thank you, Representative Wacho. Representative Nelson.
Thank you, Mr. Chair. I appreciate the second bite at the apple here. And Caitlin, I think it was in your testimony you had mentioned Pennsylvania does not have a limit on the number of years that people are eligible to participate in that program. We've heard from the county, and as they struggle with their increase in cost and this growing population, that we're actually getting people in from, let's say, Ohio and some other states, because the folks are talking and they're saying, look, if you come to Pennsylvania and sign up, you can stay on those books. Is that accurate?
Sure, were you speaking about Medicaid specifically?
Yes.
Yes. So I don't believe there's any, right now, there's no caps on lifetime limits for Medicaid. It has been floated around in the past. I believe Kansas tried at one time, but didn't prevail. But yes, that's correct. We did see that there were lots of cases of migration from those, especially in the able-bodied population, because let's not forget, those who are originally on Medicaid might have more longer-term healthcare issues. Those who are disabled, for instance, they might not be getting on and getting off, but those in the able-bodied population, they tend to move around more. We see that they tend to, there's more improper payment rates in that group. There's just less certainty, but for certain folks who are probably going to need long-term care, maybe for the rest of their lives, we don't see as much fluctuation there, but you're right, there is more migration when we opened it up to that class of adults who could get benefits. So that's kind of why we see them popping up a lot as a problem in some of the audits. And that's the figure I shared.
I do have a big heart. Sometimes, my colleagues will make fun of me, but the waiting list and we met with folks through this appropriation process. There's just under 3,000 people on the emergency waiting list, like that can't get in. So those families have people in extreme need and advanced care, as you were touching on. The 20% in your earlier response, there was an audit that showed 20% across state line. What was that? Would you be able to get us that audit? Was it a state level audit, a federal audit? It was mentioned, you don't necessarily have to reply now, but you had mentioned approximately 20% of people are double dipping across state lines, or an audit had inferred that. It'd be great to know who did that audit and maybe get some more of that data.
Sure. To clarify for that point, I think it was 20,000. 20,000 is
20,000.
what they found.
Okay.
I think that was from 2020, and it was, I believe, a federal audit.
Yeah, so that was a government accountability audit. Government accountability office, excuse me. So I can't remember what year that's from. Be glad to share it with you. The thing I would add is that audit was of managed care organizations. It seems to me that there's an issue with calling something managed care
community
organization.
health choice double dipping across.
So yeah, they would have been enrolled in managed care in both Pennsylvania and some other state.
That's even more expensive than
right.
Yes.
And so it's a little bit. It seems like it's a bit of a misnomer if you're calling it a managed care organization and they're not doing a very good job of managing.
Mm-hmm. Now, critical question from us, my last one before handing it over to the chairman. For years, the Republicans were in control, and we didn't really move the needle very much in this space, in my assessment. Who is, from your perspective, ultimately in control? Because you had mentioned, does DHS have the ability internally to start to implement some of these controls? When we talk about a legislative lift, we've seen multiple times efforts fail. We did a big welfare train, volunteer, or work package that was then vetoed because, ultimately, does the department have the ability to be able to correct itself? I mean, there are a lot of good people there. There's 14,000 of them, though, so sometimes they get lost in their own mosh. What's the secret sauce that we can kind of move the needle? Because I've been here almost 10 years, and it's really not moved.
Yeah, so on the food stamp time limit waiver for able-bodied adults, that is a waiver submitted by the department, and I believe in the Federal Register, it also says with the support or the instruction of the chief of the state, so that would be the governor. And so in some respects, that waiver at present is going to be at the discretion of the governor's office. That's what I meant earlier, though, by if you were to enact legislation that changes that dynamic specific to Pennsylvania, where the prerogative lies more under the purview of the legislature, you can reclaim that that ability to oversee that. And then I'd also say for something like hospital presumptive eligibility, where we talked about that a little bit, and the state files a state plan amendment. In that case, when Obamacare created that pathway, they received guidance from HHS about you need to submit a state plan amendment to address this new requirement. And that didn't have to come to you all. This is from 2014, but that did not have to come to you all for them to submit it. Several states have they put in requirements that a certain number of HPE determinations get referred for full Medicaid approval, full application. Pennsylvania does not have that requirement. You do have a requirement that hospitals meet a certain threshold of those who do actually apply for full Medicaid. 95% of them are supposed to be found eligible for Medicaid. That number is obviously low. I think it was 61% on that slide. It's the second column. So your hospitals are deficient from that. You may want to connect with DHS and find out what they're doing to oversee those hospitals that have maybe been in violation there. It seems that at least one of them is not meeting that threshold, and the penalty for that can be that they get removed from the HPE program. And so those are some of the types of steps that you could take.
Okay, great. Thank you, Mr. Chair.
Oh, yes, I was going to add for Medicaid and food stamps, something we hadn't really touched on, or someone may have touched on it earlier, but just how much Medicaid specifically is taking up your budget. And I think when our colleagues presented last year, you guys were #1 in the nation for your state expenditures, Medicaid being a percentage of your state expenditures. And I think you're only second to North Carolina. Yeah, North Carolina this year. But still about just right at 40% or so. And with the changes that could be coming at the congressional level, it's just going to get worse. You're just going to be on the hook for food stamps. I believe in the big, beautiful bill, you can't have any more provider taxes to help pay for Medicaid expansion. There's going to be a moratorium on that. We'll see what actually passes this summer, but next year it could be a world of hurt, and it could make budgeting very difficult. And it is, I think it's something to point out whenever you can that is just not sustainable. We cannot have our labor force participation rate keep falling while we still have folks in need and we have waiting lists, but yet we're spending billions of dollars for people with really no true push and pathway to get off of dependency and back into the workforce, because that's what drives our economy, so that we can take care of those who need it. So that's just something I would really stress about. It's going to hurt even more if there aren't changes made. And whoever is governor, whoever is in charge of legislature, wherever the majority is for Pennsylvania, the bill is going to come due, and it's changing, because obviously we can't continue to have trillions of dollars in debt. And so Congress is looking for ways to push costs onto states. So that's something that everyone is going to have to contend with, all legislatures.
Thank you. I've got one question of my own before we wrap things up here. The takeaways here are so timely, given the budget cycle that we're in. We're talking about billions of dollars in improper payments, and it's heartbreaking when 14,000 Pennsylvanians are on waiting lists, but we're spending billions of dollars sending money to places where it shouldn't be going. We talk about the billions of dollars. We could be closing the structural deficit that we're staring down as a Commonwealth. We could be addressing property tax relief, as was referenced earlier. There's a lot of things we could be doing with these billions of dollars that are being improperly paid out. So I hope hope that as this budget cycle continues, this becomes a larger part of the conversation. A couple of years ago, I saw a very interesting documentary. They were interviewing homeless people in California. And one of the women living under a bridge, homeless, struggled with substance abuse issues, and they were asking her how it was possible for her to continue to live. And she said, well, in California, they just love you to death. And she meant that literally, because she never really had to worry about food. She never had to worry about paying her bills. She never had to worry about anything, because at the end of the day, there was some sort of social program that would be paid out to her regardless, so she could continue to live a life cycle that was spiraling downward for her. And she admitted that it was because of the state social programs that she was able to continue a self-destructive lifestyle. Just a year or so, FGA had a really good focus group that I got to attend, and there was a social worker from Philadelphia, and she talked about the dangers of generational dependency on social programs, because we know that having a job, having gainful employment, is the #1 cofactor for a successful life. When we visit prisons, the #1 factor that drives down recidivism is having a job. That's why we have these programs that help inmates develop careers and skills so they can work. Somebody who is struggling with recovery, the #1 coefficient to success in recovery and rehabilitation is having a job. The #1 factor to combating mental health issues is having a job. So to cast in a light in any way that talking about benefit integrity is a negative, it couldn't be further from the truth. Allowing able-bodied Pennsylvanians to go back to work, to be part of the system, part of their society, contributing to their communities, is how we help people live productive, fulfilled, healthy lives, and also making sure that those social programs are there for those people who truly need it and deserve it. So my question is this. I know it will be almost impossible to track all of those data points, but is there anything that we can point to a state that did pass some sort of meaningful reform that you can say, oh, now they also were able to reduce their prison count, and they were also able to reduce this social program and that social program and this mental health funding? Is there a way that we could track the tertiary benefits of getting able-bodied adults back to work and also providing benefits for those people who truly need it and deserve it?
Yeah, actually, some of that work has already been done. At FGA, we do studies like that. We've got one from when the time limit waiver was stopped in Kansas several years ago. People went back to over 1,000 different industries. Within a year, their income had nearly doubled from what it had been because they'd been subject to the work requirement, got pay increases and so forth. And so we'd be glad to share those studies that we've already done. And I can tell you there's already some additional studies that we're looking into, and just a matter of time. But there is evidence from other states of the success of adhering to work requirements and so forth. And I would just add, because I know we're closing up here, it's called the Department of Human Services. We should probably make it human-centered. Handing someone a plastic card and sending them on their way does not seem very human-centered, in my opinion. I think it's more important to engage that person, and that includes providing them assistance more than just a piece of plastic.
Well, thank you very much. It's no secret that if we level funded the budget and this entire budget process, we didn't spend one penny more in 2 years, we'd still have a multi-billion-dollar structural deficit staring down the people of Pennsylvania. And then we're looking at tax increases or budget cuts, neither of which are going to be popular. So the sooner we can address this problem, the sooner we can save taxpayers billions of dollars and make sure the people who deserve and need these programs are getting it, I think it's the better. So thank you again, everyone, for being here today. Thank you, members. Thank you, testifiers. Benefit integrity starts with holding the government accountable. We have to hold ourselves accountable. We have to ensure Pennsylvania's resources, those taxpayer dollars, are efficiently allocated and accessible to those who truly deserve it. We're going to be continuing the conversation about good government next Monday, June 16th at 8:30 a.m. in the same room. We'll be talking about Pennsylvania's regulatory environment and the red tape that is burdening our families, friends, and businesses. Until then, this hearing is adjourned.